Hello, welcome back. Today we'll be looking at a very important topic, which is the axilla. And the aim of this video is to teach you how to write essays in anatomy. And today we'll be looking at the axilla, looking at an essay question, and I'll be giving you interesting mnemonics that can help you remember what to do when you are asked to write an essay about this topic. Now, the essay that we'll be using today is describe the anatomical boundaries, contents, and clinical significance of the axilla. Now, there's a mnemonic that can help you know what to do, how to form your outline when you're asked to write an essay. When you're asked to write an essay in anatomy, the first thing you should do is to write an outline. And I have a mnemonic that can help you know what to do and how to form the outline when you're asked to write an essay on cavity, on triangle, on spaces, on tracks, on canals. And this essay is and this mnemonic is ABC. A for all I need to know, B for boundary, C for content, clinical correlation, and conclusion. So your outline can be, because your all can be definition stroke introduction, location, function, boundaries, content, clinical correlation, and conclusion. So with this outline, you can write an essay on spaces, on cavity, on canals, because I will be applying this same mnemonic on other videos. So stay tuned. Now, introduction stroke definition. The axilla, also known as the armpit, is a pyramidal shaped space located between the upper arm, the upper limb, and the thorax. Now, for location, the axilla is situated beneath the shoulder joint at the junction of the upper arm and the thorax. Now, for function, the axilla acts as a conduit for major vessels, for major nerves like the brachial plexus, and blood vessels like the axillary artery and vein supplying the upper limb. It also contains axillary lymph nodes, which play a crucial role in lymphatic drainage, particularly from the breast, the upper limb, and the thorax. It provides motility and support to the shoulder region, facilitating arm movements. Now, these are what you need to write for A, all I need to know. The next is B, which is the boundaries. And I have a sentence that can help you remember the boundaries of the axilla. And this sentence is a pretty lady said hi. A pretty lady said hi. Now, this sentence helps in two ways. It can help you know what forms the boundary, and it can help you know the particular boundary we are talking about, because A, P in pretty, L in lady, S in said, H in I. So A represent the anterior, P represent the posterior, L represent the lateral boundaries. Now, for others, okay, this mnemonic is very important. Please pay attention, because it can help you know the what forms the boundary, and can also help you know what the particular boundary we're talking about. Now, for A, which represent anterior, the next word there, P, represent what forms it, which is pectoralis major and pectoralis minor. Now, for P, which is the next word in that sentence, it represents posterior. The next word represents what forms it, which is latissimus dorsi and subscapularis with and teres major. But if you can remember just latissimus dorsi in your exam, you will still have the score for the posterior boundaries. Now, the next is L, which is lateral boundaries, and the next word represents what forms it, which is the shaft of the humerus. The shaft of the humerus form the lateral boundary. And finally, the medial boundaries is formed by serratus anterior and thoracic walls. So this mnemonic is a two-way mnemonic that helps you to remember the boundary you are talking about and also help you to remember what forms what forms each boundaries. Now, moving forward, any question that is given to you in anatomy and you are asked to write on any essay in anatomy, always bear this in mind that you must sketch a diagram and you must label that diagram. Drawing and labeling diagrams in anatomy, no matter how poor the diagram is, let it just look like what you are asked. If it just look like what you're asked, the person marking that essay will give you score for it. So always bear it in mind that you are meant to sketch, draw, and label. You're meant to sketch the particular organ, the particular space you're asked to write about. Now, for the next part of our mnemonic, which is the C, which is the content, the clinical correlation, and conclusion. The content of the axillary artery include the content of the axilla include axillary artery and its branches, axillary vein and its tributaries, infraclavicular parts of brachial plexus, 5 group of lymph nodes and the associated lymphatics, the long thoracic and intercostal, the long thoracic and intercostobrachial nerve, axillary fats and areolar tissues in which other contexts are embedded. Now, for this here is a mnemonic that can help you remember the context of the axillary, the content of the axilla. And this mnemonic is BAN L. B for brachial plexus, A for axillary artery, N for axillary nerve, D for axillary vein, L for lymphatic nodes or lymph nodes, L for lymph node. Now, for clinical correlation, they might not want you to know much about this clinical correlation, but in every essay given to you in anatomy, it's always good to learn one or two clinical correlation or one or two clinical correlates about that topic. And yeah, I just listed 3. You can learn one or two, and it will help you to get marks when you're asked to write on the axilla. The first is axillary lymph nodes, which is the enlarged lymph, which may indicate breast cancer infection. Next is brachial plexus injury, which is trauma can lead to motor or sensory deficit in the upper limb. The next is axillary artery injury, and this can cause ischemia to the upper limb. Now, finally, conclusion. In concluding an essay in anatomy, you don't need to memorize any conclusions. You don't need to memorize conclusions for all the essays in anatomy. There's a simple way that can help you conclude an essay. If you know the function of what you're writing about, that can form your conclusion. So you don't need to memorize a lot of things. You don't need to memorize things about conclusion or about concluding an essay. Just know the function of what you are being asked, and it can form the conclusion of your essay. Example, in conclusion, the axilla is a vital conduit for neurovascular structure supplying the upper limb. Its anatomically important is significant in clinical diagnosis, surgical approach, and trauma management. So with this, I've concluded this essay. So if after watching this video, you can write an essay on axilla, please like, share, subscribe, and stay tuned. Hit the notification bell so that you can see when I post other interesting videos that can help you pass your anatomy. Thank you for watching.